Hello everyone. Now let us discuss about a very important sexually transmitted disease, that is syphilis. So, syphilis is caused by Treponema pallidum, which is nothing else but a spirochete. Spirochetes are gram-negative, slender, cockshoe shaped bacteria with periplasmic flagella. So, periplasmic flagella is a hallmark feature of what spirochetes. Fine? Yes. And there is a helical protoplasm. The most important microaerophilic spirochete, is a Treponema pallidum, subspecies pallidum. That is which is going to cause syphilis. And other species of treponyms like Treponema pallidum, subspecies Pertune, Caratium, all these are going to cause conditions like Pinta and Yas, which you can read in microbiology. So I'm going to discuss purely on pathology perspective. So syphilis, it is a chronic sexually transmitted diseases with a lot of clinical and pathological manifestation. It is most commonly caused by Treponema pallidum. It is too slender that it cannot be visualized by gram stain. We have dark ground microscopy or silver staining, and the most common silver stain that what we are using is what we call as Steiner. What is the name of the silver staining? This is called as Steiner. Steiner. Even Wartenstein is also used, but Wartenstein is more used for case of Helicobacter pylori. Fine. Yes. And the most important, and the Treponema pallidum cannot be grown in culture. And remember, penicillin is the mainstay of treatment. Yes. So coming into what is the pathogenesis, yes, because it is what this is the what aspect that we have to discuss. See, remember, the syphilis is mainly going to affect the small blood vessels, and as a result of which there will be plasma cell infiltrate, which is characteristic of all stages of syphilis. So what is the simple pathology? It is going to affect the small blood vessels, which is going to cause proliferative endarteritis, and which is associated with increased plasma cell infiltrate. Don't write neutrophils or lymphocytes. See, this is one of the most important pathological hallmark feature of syphilis, that is there will be plasma cells infiltrate. What is that? Plasma cell infiltrate. Plasma cell infiltrate. I hope this is very clear for you. Fine? Yes. So remember, the infiltrating the CD4 T plus or T lymphocytes are T helper 1 cells, where we have discussed the role of T helper 1 cells. Yes, Mycobacterium tuberculosis. In Treponema pallidum infection also, we have CD4 plus T cells, that is T helper 1 cells. This is very, very important point you have to remember. Fine? Yes. And, this Treponema pallidum is known to cause high antigenic variation. Because of that is it have different variants of Treponema pallidum is there. This is because of the variation in a protein which is located in the outer membrane of the Treponema pallidum. This is what we call it as TPRK. This has been asked once. Fine, in MCQ. Fine. So what are the stages? Primary, secondary, latent, tertiary, and we have a different entity called as congenital syphilis. So first let us see what are the features of primary syphilis. Each of these features is very, very important. Fine. So when they ask about a clinical scenario, so before that let me say what is the clinical scenario. Clinical case scenario of the syphilis. See, they will see a 30-year-old sexually active young male who comes with the complaints of painless, very, very important ulcer on the penis. What will be your diagnosis? And on examination, there was an indurated margin. Painless ulcer means definitely your first diagnosis should be syphilis. Yes. So, see, in primary syphilis, you will have non-tender raised red lesion, that is induration, on the penis, cervix, and vaginal wall or the anus. This is most important. This is what we call it as soft canker. This is what we call as hard canker. This is called as hard canker. Hard canker is a painless canker which is seen in syphilis. Soft canker you will see in case of Haemophilus ducrei infection. There it will be tender, painful. Secondary syphilis is marked by painless superficial lesions of skin and mucosal surface, and you have something what we call as condyloma lata. Condyloma lata is caused by syphilis. Condyloma acuminata is caused by human papillomavirus. What is condyloma lata? They are broad-based elevated plaques Okay, yes, and the patient may also have lymphadenopathy, mild fever, malaise, and weight loss. Tertiary syphilis is mainly the complication, okay, very serious complication like cardiovascular syphilis, neurosyphilis, and benign tertiary syphilis. Cardiovascular syphilis mainly it causes syphilitic aortitis, okay, and remember the patient may finally die because of rupture of aortic aneurysm and aortic wall insufficiency. In neurosyphilis, you will have something what we call as tabes dorsalis, okay, tabes dorsalis, okay, tabes dorsalis, I'm writing here, tabes dorsalis, fine, and there will be elevated protein level, decreased glucose, and increased number of polymorphonuclear lymphocytes, leukocytes in case of in CSF. And benign tertiary syphilis is characterized by the formation of what we call as gammas. I will explain what is gammas very soon, okay, in bone, skin, and mucous membrane of upper airway and mouth. Then coming to see what is you can see here, no, tabes dorsalis, aortic regurgitation, aneurysm, and gammas. And what is congenital syphilis? Congenital syphilis, we have something what we call as Hutchinson's triad, okay, which is characterized by interstitial keratitis. Congenital syphilis has a characteristic triad of interstitial keratitis, Hutchinson's teeth, and eighth nerve deafness. Okay, what is that? Interstitial keratitis. Then that is interstitial keratitis means that is inflammation of the stroma, okay, of the cornea. Then Hutchinson's teeth and eighth nerve deafness. Fine. Yes. See, congenital syphilis. Congenital syphilis, no, it is because of the pregnant lady may be having any primary or secondary syphilis, and that may be what transmitted towards the baby. Okay, yes. Okay. Then you know what are the serological tests for syphilis? You know, serology is the mainstay of diagnosis. We have Treponema pallidum, specific and non-specific test. We have lot of tests: Treponema pallidum, fluorescent hemagglutination assay, absorption assay, FT-ABS. Okay, lot of serologies are there. You can learn all those from microbiology. Fine. Coming to morphology, this is the point that we have to focus on. I told you that in primary syphilis, we have a canker on the penis or scrotum. Okay, remember in scrotum is also very common. See, this is a picture. You can see a canker. Okay, this is a hard canker with a well indurated margin. Remember, it is painless. Okay, as well as in vulva or the cervix in case of women, and it is slightly elevated. You should know, very important children, you should know how to explain this canker. Okay, remember it is slightly elevated, it is firm, reddened. Okay, papule means what? Palpable lesion. Okay, palpable skin lesion with a clean shallow based ulcer. Okay, clean shallow based ulcer. Fine. Yes. And remember, on histological examination, I told you that there will be intense plasma cell infiltration, CD4 plus T helper 1 cells. Remember, and I told you that there will be proliferative end arteritis. Okay, intimal fibrosis and plasma cell rich infiltrates. These are the three important points. What are the three important points? Yes, number 1 is what we call as proliferative end arteritis. Number 2 is plasma cell infiltrate, and number 3 is what we call it as fibrosis of intima. Okay, intimal fibrosis. These three hallmark features you have to mention. In secondary syphilis, I told you there will be what we call as condyloma lata. That is, they are nothing else but painful mucocutaneous lesions which involves the oral cavity, palms of the hands, and soles of the foot. Fine. And remember, histologically here also it will having plasma cell infiltrate, proliferative endarteritis, but you know the inflammation will be less intense than that of the primary syphilis. Tertiary syphilis, I told you, it is most frequently involves the aorta, CNS, bones. In aorta we have what? Aortic aneurysm, aortic valve insufficiency. In CNS we have tabes dorsalis. In liver, bones, and testes we have gummatous lesion. Okay, yes. Here also we will have again aortitis. Okay, aortitis. Okay, fine. And there will be loss of elasticity of the aortic valve. You know, aorta is highly elastic. Okay, yes, but that will be lost. In meningosyphilis we have meningovascular syphilis, tabes dorsalis, and finally general paresis. And what is syphilitic gammas? See, you can see here, this is a picture of a trichrome stain of the liver which shows a gamma, okay, which is stained blue. What you can see here, no, this is a gamma. Okay, gamma. This is seen in case of what? Tertiary syphilis. What is this gamma? They are nothing else but what? The white, grey, and rubbery microscopic lesions. Okay, this actually resembles like some tumors. Okay, that is why they are called as gammas. Okay, most commonly they will be seen in liver. Okay, and in liver it may cause a distinctive lesion called as hepar lobatum. This has been asked once in AIMS. Okay, what, in which condition you will see hepar lobatum? Hepar lobatum. Hepar lobatum is nothing else but the characteristic or the distinctive lesion produced by the syphilitic gammas in liver. Okay, liver, hepar lobatum. Remember, it is seen in case of tertiary syphilis. Yes, tertiary syphilis. Very important. Okay. Once that is done, on histological examination, there will be coagulation, necrotic material, margins will be composed of palisading macrophages and fibroblasts, again chiefly plasma cells, very very important. Okay, yes, and usually we can't demonstrate any Treponema pallidum organism within this gammas. Okay, so just remember about syphilitic gammas, just remember where they are found, actually what are they, histologically what they are composed of. These 3 points you have to remember hepar lobatum. Then congenital syphilis, I told you congenital syphilis will have what, saber shin, okay, periostitis of the tibia, saddle notch deformity, osteochondritis and periostitis of the bones, okay, and again we will have gammas in liver, then interstitial fibrosis, and the characteristic triad is interstitial keratitis, Hutchinson's teeth, and the 8th nerve deafness. Okay, these are some of the important points you have to remember in case of congenital syphilis. Okay, yes. So with this we have finished syphilis. So as far as syphilis is concerned, just to remember what is the causative organism, what is the stain used for diagnosis, what are the serological tests, what is the basic pathology, what are the different stages, triad of congenital syphilis, then what are the clinical manifestations of cardiovascular, neurosyphilis and benign tertiary syphilis. Then you have to remember the morphology, remember the 3 important points: proliferative endarteritis, plasma cell infiltrate, fibrosis, okay, of the tunica intima fibrosis. These are the 3 hallmark features what you can see in case of primary syphilis. In secondary syphilis, the most important thing is that almost all these features, but condyloma lata, mucocutaneous painful lesions. Tertiary syphilis, I have told you the patient most common cause of death in syphilis is rupture of aortic aneurysm, aortic wall insufficiency may be present, meningovascular syphilis will be present, tabes dorsalis will be present, hepar lobatum, very very important, they are gummatous lesion, distinctive gummatous lesion seen in tertiary stage of syphilis in the liver. Okay, they will be having palisading macrophages with the fibroblast located on the periphery. In congenital syphilis, we have a characteristic tear of Hutchinson teeth with interstitial keratitis and 8th nerve deafness. Of course, we'll have saddle notch deformity, what is saber shin. All these are also features of congenital syphilis. Just know the key features. Okay, they won't ask any essays and all in syphilis, but TB they will ask us an essay. Syphilis, they may give you a small case scenario for a short note question. You may be asked to write about the morphology. As far as path is concerned, if you write clinical features, all those stuff, they won't put marks. Okay, as far as path is concerned, you have to explain about all these morphological features. Hepar lobatum, very very important, it has been asked as an MCQ. So hope I have explained all about syphilis as far as path is concerned. Fine, thank you.